Welcome back, everyone. Now at 5:30, Women's Health Headlines, where we focus on health stories that are specifically impacting women during Breast Cancer Awareness Month. And tonight we're talking about the evolution of the mammography from film to 3D technology. And joining us now is Dr. Diana James, head of breast imaging at Jefferson Radiology. Dr. James, thank you so much for taking some time to be with us tonight.
Absolutely. Thank you, Erin, for having me. Appreciate it.
Of course. And in terms of the last 50 years, what would you say is the biggest advancement in technology that you've seen?
Absolutely. So it's that 3D mammography or that tomosynthesis imaging that you've probably heard about. We began mammography back in the mid 1980s, and then we went digital in the year 2000. And then in 2011, a first vendor was FDA approved for 3D or tomosynthesis. And that was a huge game changer for women, particularly with dense breasts.
And what does it specifically do? Does it make it easier to see a possible cancer situation? What would be, in layman's terms, the benefit and the overall health impact for women?
You said it exactly right. So it helps us see through the layers of tissue to find the cancers. So we saw the cancer detection rate go up by 40% when we introduced the 3D tomosynthesis exam back in 2011. That's a huge number, 40% better. And the other great thing about it is that less women have to come back to get a checkup. So many women have gone through this whole process where we see something on the mammogram, they have to come back, get it checked out, maybe get an ultrasound. That happens 15% less of the time now with this new technique. So there's less worry. We're finding more cancers. It's a lot better.
Well, that is incredible. And 40% is an unbelievable impact on the overall health of women. I also want to ask you, for women who are watching tonight, is there a specific age when they should go for their first mammogram, and thereafter, should it be every year? What do people need to know?
That's a fantastic question. And I wish I could say we had national consensus on that question. We still really don't. But I'd say the American Cancer Society and the American College of Radiology recommend starting screening at age 40. Because we know when we introduced just mammography in general, we saw a 30% reduction in mortality, which is deaths from breast cancer. So we know it's a good screening test. And we know that there was a really good impact between 40 and 49. I mean, those women are so critical in that age group to the workforce and taking care of families. So we don't want them to be left behind. I will say that is not what the USPTF, the United States Preventative Task Force, recommends. They say 50. So I would say talk to your doctor. I'd say most doctors in Connecticut and your OBGYN or maybe a surgeon or oncologist would recommend starting at 40. But there is a little bit of controversy, to be honest, about it.
Okay. And then do you go every single year after that? Is it an annual type of test?
So it really should be annual up until menopause. And then I think you could maybe go to every 2 years, depending on what you and your doctor decide. I think it's a good conversation to have with your doctor.
Okay, a lot of good information. Thank you so much, Dr. Diana James of Jefferson Radiology. We appreciate all of your insight tonight.
Great. Thank you for having me again. Thanks.
Yeah, some great